State your name.
Steve Lord.
And your occupation.
I'm retired.
What was your occupation?
I was a cop for 22 years. Before that I was a Marine, and now I'm currently an actor.
Okay. Steve, what were your initial complaints?
Migraines. Debilitating migraines.
What did you try to do to help your problem that didn't work? Example, pills, doctors, physical therapy, traditional chiropractic, heating pads, before you came to upper cervical chiropractic.
I tried all of them, tried alcohol, I was trying acupuncture, anything that I could think of, pre-medicating myself before I go to work with aspirin or Tylenol, or I was even taking Tylenol 2 hours and then Advil 2 hours later, so I'd had 2 different types of pain relievers in my head, and nothing was helping. It was to the point where I was getting very, very desperate, and my mother-in-law, who still lives in the area, she found a newspaper article when Dr. Larry first opened the practice, and the first thing that caught my eye was, "Are you suffering from migraines?" And I went, "Oh God, yes I am." And by seeing the name Arbeitman, it was very familiar to me, and so there was that familiar response that I can trust this person because his uncle was my gym teacher back in the 70s, and the Arbeitmans are an old Manalapan name, so you can trust it. And so I immediately called him up, left a message. He immediately called me back, which was the cool thing about it, and brought me in, explained to me about all this upper cervical stuff. I thought it was another form of witch doctor or witchcraft stuff because I tried everything else. But he laid me down on this table here and started pushing behind my ear and stuff like that. And I was like, this isn't the chiropractics that I'm used to. You know, this seems like it's going to be a waste of time. 2 weeks later, I was thinking something totally different. I couldn't believe that by doing so little, so much was being accomplished. You know, I was used to the traditional chiropractics where they're putting in a figure 4 leg lock and they're trying to tap out because they're snapping your spine this way and that way. That didn't work. Just that little, and once I started getting into more of what he was explaining to me and listening for those signs, like now whenever I know he's putting me on the table, I'm listening for the little snap, crackle, pop, like if you were listening to that bowl of Rice Krispies. If I hear the cracks, I know that my atlas is being moved around. He's explained everything to me in detail as to what's going on. Anyway, long story short, 3 or 4 weeks after that, my migraine started subsiding. Within 2 months, I was pretty much cured. 6 months later, I was coming in just for maintenance. And I stopped getting sick because I was always around nasty people, you know, that had bubonic plague or whatever when you're locking them up. They don't always have the nicest hygiene habits, and so, you know, your health is one of your major concerns when you're a cop. I wasn't concerned about that anymore. I wasn't getting sick, not even a runny nose, and so I felt I was cured. 5 years later, here I am saying hello again.
So obviously this affected your home life, work, relationships, and hobbies. And now that you said that, how do you feel now?
Well, I came back here 5 years later in a lot worse condition than I was the previous time. This time I couldn't move my head at all to the right. I mean, I could lean my head over to the left, but if I tried going this way, it stopped immediately, and pain would shoot down my arm. Ultimately, it became both arms. Then it became a question of me starting to have a problem breathing. There was something going on with my cervical spine. I understood this. I had a previous neck injury playing football back in 1980. I broke my neck. So I know what it's like to know when there's a neck injury and it's affecting your breathing. So I called up Dr. Larry, and here we are now, 2 months later, and I have full 360-degree movement of my head, whereas before I couldn't even turn my head to the right to talk to somebody. It was an experience to try and drive because you would have to physically turn this way to look to see, make sure you wasn't going to cut anybody off. Now it's normal again, and that's what we like.
So do you plan to continue on wellness care to stay healthy?
Yeah, I think I learned my lesson.
What would you tell others who are considering upper cervical chiropractic care but who are unsure about it?
Try it out. Try it out for a couple of weeks. You have nothing to lose and everything to gain. I mean, the only thing you're going to lose is money spending stuff on things that you don't need, like pills or regular chiropractors or drugs or alcohol or whatever else, you know, voodoo, whatever you're into. Give it time. It doesn't happen overnight. You didn't hurt your neck overnight, unless you broke it. But within a few weeks, you'll notice a change. My wife, she's been away this past week. When she came back from Pennsylvania, she asked me if I was taller, because now my spine is straightening out and I'm standing more taller. I'm standing more erect. I can move around freely. I actually walk now feeling balanced. When I used to walk, it felt like I was leaning to port, or I was leaning to, sorry, it's a jarhead term. I was leaning to the left or to the right. I always felt heavy on one side. Even like going up steps or something, I would have to always grab one banister because I felt like I was going to fall over to one side. Now I feel like Tinkerbell. All 6'5" of Tinkerbell, climbing up the stairs.
Awesome. Thank you so much, Steve.